Today, we're going to break down the subtle, visible signs of undiagnosed diabetes, clues you might literally be able to see on your own body. And why does this matter so much? Because spotting diabetes early is absolutely everything when it comes to preventing serious and often permanent complications. So let's get right into it. Now, get ready for this, because it's a truly wild statistic. 1 out of every 4 American adults who has diabetes has no idea. They are completely unaware. That's millions of people just walking around while this condition could be quietly damaging their bodies. So you have to ask yourself the tough question. Could you be one of them? I really want you to pay close attention, because the signs we're about to cover could be the exact wake-up call you or someone you love really needs to hear. Okay, so what is diabetes, really? Well, in a nutshell, it's when your body struggles to manage its blood sugar. Now, there's type 1, which is an autoimmune thing. But today we're focusing on the big one, type 2, which is way more common. That's where your body's cells start to kind of put their hands over their ears and ignore the insulin that's trying to get sugar out of your blood. You know, some of the very first clues are ones you can't even see. Like, are you getting up multiple times a night to pee? And are you just thirsty all the time? What happens is your kidneys go into overdrive trying to flush out all that extra sugar, and they pull a ton of water out with it. This kicks off a crazy vicious cycle. The more you pee, the thirstier you get. And trying to fix that with a soda or juice? Whoa, that's just throwing gasoline on the fire. All right, now for the main event. Let's talk about the signs of diabetes you can actually see. And I'm serious, if you've got a mirror nearby, you might want to grab it for this next part. First up, we've got this condition with a mouthful of a name, acanthosis nigricans. Basically, you're looking for these dark, kind of velvety-feeling patches of skin. The most common spots are in body folds, so check the back of your neck, your armpits, or even your groin. This isn't just some random skin thing. It's like a giant, flashing neon sign for insulin resistance. It's happening because your body is pumping out so much extra insulin that it's actually causing your skin cells to multiply. And the skin clues don't even stop there. If you've noticed a bunch of new skin tags popping up, especially in those same areas, that can also be a sign. On top of that, you have to think of high blood sugar as an all-you-can-eat buffet for bacteria and fungi. It's literally their favorite food. This is why people might get frequent skin infections, abscesses, and even UTIs. That extra sugar in your urine creates the perfect breeding ground for nasty bacteria. Now we're going to get into the core reason why so many of these other physical signs happen, especially in your hands and joints. I like to call it the sugar coating problem. The fancy medical term is glycosylation, but sugar coating is pretty much exactly what's happening. All that excess sugar floating around in your blood starts to literally bind to proteins all over your body. Imagine dipping your tendons in sticky caramel. Over time, that sugar coating makes them thick, stiff, and a whole lot less flexible. You can actually check for this yourself, right now. Seriously, do it with me. Put your hands together, like you're praying. Now try to press your palms completely flat against each other, with all your fingers touching totally straight. Can you do it? Or is there a little gap between your fingers or palms? If you can't get them flat, that's what we call a positive prayer sign. It's a really clear indicator of what we call diabetic stiff hand syndrome, and it's caused directly by that sugar coating process. And this isn't just about your hands. That same sticky sugar coating process is the culprit behind other painful problems, like trigger finger, where a tendon in your finger gets stuck and then snaps, or the miserable and debilitating frozen shoulder. Now, moving beyond your joints, we have to talk about your nerves. High blood sugar is pure poison for them. This damage is called diabetic neuropathy, and it can cause numbness, tingling, or even pain, especially in your hands and feet. And listen, I know numb feet might not sound like a big deal, but trust me, it can be incredibly dangerous. Let me tell you a quick story from my time in the hospital that I will never forget. I was treating a patient with a really nasty foot infection, and deep inside the wound, I found an office staple. A staple! He had absolutely no idea it was there. He never felt it go in, and he couldn't feel the horrible infection it was causing. That is the danger of neuropathy. You lose your body's own alarm system. And over time, this is what can happen. When you can't feel your feet, tiny injuries go completely unnoticed. You keep walking on them, causing fractures that don't heal right, and eventually the entire structure of the foot can just collapse. It's a condition called Charcot foot. And just look at this timeline. A perfectly normal foot can be destroyed in as little as 10 months, ending up with this classic rocker bottom shape. It's because of this devastating combination, the numbness, the unnoticed injuries, the poor healing, that diabetes is the #1 cause of amputations in the US that aren't from some kind of accident. This is why, and I cannot stress this enough, if you have diabetes, checking your feet every single day is completely non-negotiable. Okay, I know that was a lot, and it was pretty heavy stuff. But remember, knowledge is power. Now that you know the signs to look for, let's talk about the solution. Let's talk about getting a real diagnosis. Believe it or not, hundreds of years ago, doctors used to diagnose diabetes by literally tasting a patient's urine for sweetness. Yeah, thankfully, we have much better tools now. A random blood sugar test can give you a snapshot, but it's just one moment in time. The real gold standard is the hemoglobin A1C test. Remember that sugar coating? Well, this test measures how much sugar has gotten stuck to your red blood cells, which gives your doctor an accurate average of your blood sugar over the last 2 to 3 months. And here it is, the magic number. A hemoglobin A1C level of 6.5% or higher is what officially puts you in the diabetes category. So, who should be getting this test? Well, obviously, anyone who's experiencing the symptoms we've been talking about. But the American Diabetes Association also recommends that all adults get a baseline test starting at age 35. And if you have other risk factors, you'll want to get checked out even sooner and more often. And that brings us to the final and honestly, the most empowering part of all of this. Let's talk about your prevention playbook. It really all boils down to these 4 pillars. For your diet, you want to focus on high fiber, less sugar, and way fewer processed foods. For exercise, a good mix of cardio and strength training is perfect. Those 2 things are crucial for maintaining a healthy weight. And last, lifestyle. If you're a smoker, please let this be your sign to stop. If there is one thing you take away from all of this, let it be this. Diabetes is manageable. It is not a death sentence. The absolute key, the most important thing, is to catch it early, before any irreversible damage is done. So now you know the signs, you know the stakes. The only question left is, what's your next move? If anything we talked about today sounded even a little bit familiar, please don't wait. Make the call. Talk to your doctor.